Hello everyone, we are Group 1 and our team consists of Shaira, Geraldine, Ricky, yours truly, Jessica, Rian, and Sajib. And today we will be presenting about Parkinson's disease and we will share a brief description, scope of the disease, its signs and symptoms, and the causes and risk factors. We will also talk about how it affects a person's daily life and challenges they face. We will discuss how to promote a safe and supportive environment for clients, as well as the communications challenges they may experience and the most effective strategies to help them communicate better. Lastly, we will cover recommended treatments and local resources and organizations in Canada that can support people living with Parkinson's. Thank you, and we hope you learned valuable information from our presentation.
Hi, good morning everyone. I am Shaira and I'm going to talk about the understanding of Parkinson's disease, the scope of practice, and the common signs and symptoms. So we all know that Parkinson's disease is a progressive disorder of the nervous system that affects a person's ability to control the body movements and coordination. It can cause by the loss of the brain cells, which produce a chemical called dopamine, which helps to control our body movement and coordination. The scope of disorder, it is not curable but manageable with medications, therapy, and support. So the symptoms progress over time, often starting gradually and worsening, meaning when a person having a Parkinson's disease, they don't appear suddenly or all at once, but rather they begin mild or barely noticeable and then get worse little by little over time. So it can affect both movements and cognitive functions. There are two common signs and symptoms, which are the non-motor symptoms and motor symptoms. Motor means movement. So first symptoms for motor is tremors or shaking, usually in hands or fingers. And next is muscle stiffness. Usually their muscles feel tight, hard to move, or less flexible than usual. Next is bradykinesia or slow movement. So they move slowly than normal. And then the other symptoms will be impaired balance or coordination. They are at risk of falls because of difficulty staying steady or moving smoothly. So the last symptoms for motor symptoms would be the shuffling walks or stoop posture. They may be having trouble lifting their feet fully off the ground. The second common signs and symptoms would be the non-motor symptoms. So non-motor means are the symptoms that affect other parts of the body or mind or cognitive functions, like depression, mood changes, fatigue, sleep disturbance. They may be having trouble sleeping well, and constipation, difficulty in pooping. So my key message to the family, to those having Parkinson's disease, although Parkinson's disease is a lifelong condition, but your loved one can still maintain independence and quality of life with your support system and the right care strategies. So that would be all for mine. Thank you.
So, hi everyone, I will be sharing about the causes and risk factors of Parkinson's disease. Parkinson's is a slow, long-term disease that affects the movement. It begins when a part of the brain called the substantia nigra starts losing its dopamine-making cells. Dopamine is the chemical that helps us the body to move smoothly. It also affects the mood and the pleasure. Usually, people lose these cells very slowly as they age. But for those with Parkinson's, the loss happens much faster. Symptoms start showing when over half of these cells are already gone. There is no single cause. It could be genetic or caused by environmental toxins. About 10 to 20% of cases are inherited. In those cases, a person gets a faulty gene from one or both parents. but for most people, it's idiopathic, meaning we don't know the exact reason. It may be a mix of family history and things like pesticides or chemicals they were exposed to over time. Some also have the tiny protein clumps in their brain called Lewy bodies, which may be connected to the disease. There are also many risk factors. The biggest one is the age. Most people are over 60 years old. Men have a slightly higher risk. Having a close relative with Parkinson's can double your chances. Being exposed to a certain chemicals over time, like in a farming or factories, may also increase the risk. Head injuries like repeated hits to the head in sports may also play a part. So while we don't know one exact cause, there are many things that could lead to Parkinson's or make someone more likely to get it. Something I want to leave with you today is this. Parkinson's is not something we can fully prevent, but learning the causes and the risk factors help us understand the condition better. It reminds us how important early support and awareness are. Let's be patient, kind, and informed. That's the best way or support that we can give to someone. Thank you.
I'm going to talk about the effects on daily functioning. First is mood disorder. This impacts their motivation and social interaction. Second is cognitive changes. They may experience memory problems and difficulty concentrating. Third is tremors. Tremors are involuntary shaking. We also have bradykinesia, which is slowness of movement. And the last one is rigidity, which is muscle stiffness that can limit their mobility. I'm also going to talk about challenge with people who have Parkinson's. Physical limitation. Difficulty with motor skills can make their task difficult, like buttoning their shirt, writing, or even using utensils. Second is social isolation. Social isolation, an individual may experience withdrawing from social activities. Third is caregiver strains. So the person who's providing care may experience stress or burnout. So the last one that I'm going to tackle is promoting a safe and supporting environment. So first is encourage them to do physical activities. For example, encourage them to walk or do yoga, or if they can swim, like invite them to swim. And second, encourage them to participate in a small group for individuals with Parkinson's disease. And the last one is encourage therapy or counseling to address emotional changes.
Hello everyone. Today I want to share the communication challenges faced by the people with Parkinson's disease. People with Parkinson's often have trouble with their voice and speech. One big problem is a soft voice called hypophonia, which makes them sound very quiet. Many don't even realize they are talking softly. They might also have a flat voice without emotion. This monotone speech makes it hard to know how they feel. Some people have slurred or unclear speech. Their voice may sound hoarse or breathy, and some words can be hard to catch. Other problems include speaking too fast or too slow. Some people pause a lot or stutter, which make it confusing to the listeners. Many also have less facial expression, so it's hard to see if they're happy or sad. Lastly, they can have trouble finding the right words or making sentences. These issues can make it tough for them to connect and communicate with others. Now let's look at some ways we can help make communication easier for people with Parkinson's disease. One way is voice therapy, like LSVT, which stands for Lee Silverman Voice Treatment Loud, which helps them speak louder and clearer. It's a proven to work. Another tip is to remind them to use a strong and clear voice. Changing the environment is also important. A quiet, bright room without noise helps them focus on talking. Using simple words and questions that can be answered with a yes or no make it easier for them to join the conversation. Other helpful ideas include using gestures or writing to support what they say. Always give them enough time to think and answer. And don't interrupt. Check if they understood by repeating or summarizing what was said. Devices like speech amplifiers can also help make their voice louder. Lastly, practicing online or through video calls helps them keep using these skills even from home. Thank you.
Hi everyone, my name is Ryan and I'm here today to talk about the recommended treatment for Parkinson's disease. The first one is medication. Levodopa and carbidopa is the most commonly used medication. It helps reduce shaking, stiffness, and other movement problems. Other medication like dopamine agonists and MAOB inhibitors also support the brain function and help manage symptoms. These medications are effective because they restore brain activity, reduce symptoms, and improve movement and overall quality of life. In addition to medicine, the second type of treatment is therapy. These include physical, occupational, and speech therapy. Physical therapy improves balance and walking, occupational therapy helps with daily tasks, and speech therapy supports with clear communication. When combined with medication, these therapies help clients stay independent by improving mobility and communication, lowering the risk of injury and keeping them socially connected. The third recommended treatment is lifestyle change. This includes regular exercise such as walking or yoga, which help improve movement and overall well-being. Eating a healthy diet support both brain and body health, while having a consistent sleep routine can improve rest, energy levels, and reduce stress. These changes are beneficial because they can slow down symptoms, improve mood, lower stress, and help the person feel more in control of their condition. Lastly, there's deep brain stimulation or DBS. This treatment is usually recommended when medications are no longer working well enough. A small device is surgically placed in the brain to send electrical signals that help control movement. DBS is beneficial because it reduces shaking and stiffness, improves movements, and may lower the need for high doses of medication, allowing the person to feel better and live more comfortably. In summary, these treatments, medication, therapy, lifestyle change, and DBS work together to help people with Parkinson's live safer, healthier, and more independent lives. Thank you.
Hello everyone, myself Shajib Chakraborty, and today I will be sharing 3 helpful organizations that support individuals and family who are affected with Parkinson's disease in Canada, and this resource offer information, service, support for both clients and caregivers. And these 3 organizations are Parkinson Canada, and the second one is the Toronto Western Hospital, and third one is the Michelle J. Fox Foundation. And these 3 are very helpful. And let's talk about the Parkinson Canada. It is the leading national non-profit organization dedicated to improving the lives of the people who are suffering with Parkinson's. It has serving in Canadians for decades through education, advocacy, and support. The second one is the Western Hospital. This is the Canada's top medical center that focus on advanced care to research for Parkinson's disease, and it's a part of the University Health Network and help clients to receive specialized treatment plans. And third one is the Michelle J. Fox Foundation. Basically, this one is the US-based organization, but they also provide excellent resource for Canadians too. It's globally recognized for its effort for funding Parkinson's research and educating the public for new treatment and clinical trials. Well, now let's talk about what each organization offer to support people with Parkinson's. So let's start with the Parkinson's Canada. They provide wide range of serving, including educational materials to help families to understand the disease, a toll-free support line to speak with trained staff, and local and virtual support group, and a free webinar for caregiver and also for public. This makes it easier for families to get emotional and practical help in one place. And let's talk about the Western offer. They offer neurology specialists who design for personalized care plans, and also access to the physiotherapist, occupational therapist, and speech therapist, and also advanced treatment like deep brain stimulation, is called DVS, and also ongoing research trial for eligible patients, and is one of the best place for managing complex cases for Parkinson's, especially in Ontario. And let's talk about the Michelle J. Fox Foundation. They provide easy to understand research update, guide, and videos to help families to cope, and the clinical trial matching tool and online community engagement for the support and inspiration. It keeps families informed about the latest breakthrough and the ways to get involved in the fight against Parkinson's. And these three organizations play a vital role in helping Canadians to manage the challenges for Parkinson's disease. Thank you.
In our conclusion, Parkinson's disease can be hard, but having family support really helps. With good care, people with Parkinson's can still live a happy and meaningful life. Thank you for coming today to learn and to support your loved one.